This is a Jet 24, Funk 66, your Erie.com special report.
Good afternoon. We interrupt our regular programming to bring you a special report, Erie County's weekly briefing on the spread of and fight against COVID-19 in Erie County. We also expect to hear more about the vaccine rollout in Erie County. We want to go live to the studios of WQLN and Erie County Executive Kathy Dahlkemper.
Good afternoon, and thank you for joining me for our weekly update on COVID-19 pandemic here in Erie County. I'm going to start with some pretty good news today. We have 23 new cases to report, which of course is one of the lowest numbers we have seen in a very long time. In fact, looking back, I don't think we've seen numbers in the 20s since late October. So that is the good news. And that brings us up to a total of 16,220 cumulative positive cases since March here in Erie County. Unfortunately, I have 5 additional deaths to report here in Erie County, and of course that's just heartbreaking. And that brings us to 413 deaths reported in the NED system of residents in Erie County who have passed from this pandemic. And my heart truly goes out to each and every person, of course, who has passed away, their loved ones, their friends, their neighbors, all those people who are going to miss those individuals desperately. And my heart goes out to all those who have suffered and continue to suffer from the effects of this virus and the symptoms that it brings about. I know I had a friend tell me since early January when she was first diagnosed, her fatigue has just been incredible, and every day she gets a little bit better. But here we are, a third of the way through February, and she's still experiencing quite a lot of fatigue. So people are experiencing symptoms long after the virus, the contagious stage and the major effects of the virus are over. As of this morning, there were 40 total COVID-19 hospitalizations within Erie County at our area hospitals, and we had 3 individuals on ventilators in Erie County. Again, those numbers are better than we've seen most recently, so those are all very good signs that people are helping us to mitigate the spread of this here in Erie County. The positivity rate for Erie County was 10.8% from January 29th through February 4th, according to the Pennsylvania Department of Health. So as I said, it's encouraging to see these numbers dropping, and I want to thank everyone who has been following the protocols that we've been talking about here for many, many months, doing everything that you can to help get those numbers down, and then let's all work together to keep those numbers low. I said early on in this pandemic that I really truly believe in Erie County and that we can set the standard for other counties in how to fight this virus, and we've done that before and we're doing it again. So in many ways we are setting that standard, and again I thank those who are helping us get there. We know everyone is also anxious about getting the vaccine, and we're all experiencing frustration with this. You know, I'm old enough to remember Cabbage Patch dolls, and somebody said this is sort of like back in those days, but this is much, much more serious than something like that. And what we have to do is we have to exercise patience. It's the best thing that we can all do right now, knowing we can follow the guidelines that we've been given, and we can keep, hopefully, ourselves safe until we have that opportunity to get the vaccine, and even after we get the vaccine. So as the vaccines continue to slowly trickle into Erie County, and while we patiently await our turn, there's a new online tool that the state has put forward called Your Turn that you can use if you are interested. It allows you to put your name into this tool, this database, and then you will be notified when your vaccine prioritization category begins. So your turn alerts you when, again, your category, whether that's 1A, 1B, 1C, category 2, happens, and then you'll know it's time for you to go out and schedule your appointment for the vaccine. You can find this tool at pa.gov/guides/get-vaccinated. If you do not have the internet or are unable to access the Your Turn tool through a computer, you can also call 877-PA-HEALTH. That's 877-PA-HEALTH, PA-HEALTH. And then you can speak with a representative to determine your eligibility, and I believe they'll get your name into that database. Again, if you are not in the high-risk category, we're asking you to wait to get vaccinated so supplies are available for the most vulnerable people in our community. And while you wait for that vaccine, please continue to wear your mask, cover your nose and mouth with that mask, stay at least 6-foot distance from anyone that does not live in your home, stay out of crowds with staying home as much as possible, and if you're feeling ill at all, please, please stay home, stay isolated from others, get tested, and then obviously stay quarantined, isolated until you are done being contagious. With the new variants of this virus spreading every day across the globe and across this country, there are worries about that variant, and a number of other things are still of a concern. We're not out of the woods yet with this pandemic, but I want to again thank you for what you've all done. And now I'm going to ask Melissa Lyon, the Director of the Erie County Department of Health, to give us an update from the Health Department. Melissa?
Thank you, County Executive. It's always a pleasure to join you on these press briefings. So today I will keep my comments brief, but really wanted to talk about the encouraging news that you shared of the 23 new cases today. And prior to those 23 cases, we had lower numbers in the 40s. And so ideally, we are doing all of the case investigation for each one of those positive cases. So that's excellent news. And what's really important is that individuals that are listening today, and if you could share this information, is when you get a call from a county health department disease investigator, that you follow their direction. And if that direction is to isolate, it's still very important that the isolation be followed. And then if you've been called and you are asked to quarantine, again, it is so important that you quarantine for the period of time that has been asked of you. This is one of the main fundamental public health interventions that we know that works, that prevents the spread of the virus. With additional variants becoming more prevalent throughout the world and here in the United States, we need to continue to use these mitigation efforts. It's just so incredibly vital right now. If you don't isolate or you don't quarantine, you are potentially spreading virus to others. And it's so important that we prevent that from happening. So I want you to know that we are back to doing really robust disease investigation and contact tracing, and we will continue to do so. In addition to that, again, testing. I know we're all excited about the vaccine, and that's very important as well. We need that to get through this pandemic, but testing is still important, because by testing, that's how we determine if you have disease and then if you need notified for isolation or quarantine. We are also using testing to send for sequencing to determine if the variants of the COVID-19 virus are in our community. So if our testing goes down, we are in a position where we could miss finding those variants in our community. So please, if you're not feeling well, you believe that you need to have a test, please do follow up, schedule those tests. We are doing those at the community centers as we have in the past. The information is on the Erie County website. And from my knowledge, it's pretty easy to schedule a test at this point. So I will stop there and I will hand it back to you, County Executive. Thank you.
Thank you so much, Director Lyon. The Erie County mission is to provide a safe, healthy, and vibrant environment for our residents while promoting justice and equity in the community that we serve. And since the start of the pandemic, the Health Equity Branch at the Erie County Department of Health has worked diligently to partner with underserved populations and the community groups that serve them to communicate important information from a trusted source. State data show that Erie County has been among the best in our region and the state at collecting race and ethnicity data. And we are so grateful for our community partnerships and the work being done to drive testing and vaccination efforts, mitigation efforts on this virus in historically underserved populations. And so to speak a little bit more on this, I am pleased to have with us today Dr. Andrea Jeffress, and she will now speak about that and a number of other issues. Dr. Jeffress?
Good afternoon. How are you? I thank you today, County Executive Dahlkemper, for your leadership, and thank you for inviting me today to talk about the partnerships that the Health Department in Erie County has really taken a magnificent leadership role in helping get the underserved communities in our region tested, both symptomatic and asymptomatic. And we're really proud of the work that has been done through the leadership of MCIC and the community centers, the 4 major community centers in Erie, the Booker T. Washington Center, the Quality of Life Learning Center, the Martin Luther King Center, and the John F. Kennedy Center, have really done a magnificent job at coordinating these pop-up rapid testing sites to help mitigate the spread in the underserved communities. And so we really are grateful for the partnerships. Those programs have been renewed over the next 6 months. And even though the amount of testing has been reduced, there are only 100 tests allowed at each site. Those testing sites do continue to serve a great need in early detection, so that, again, like the Department of Health has recommended that we continue to isolate and follow the directions so that we can mitigate the spread in our communities. I really also am happy about continuing the possibility of getting vaccinations through the same program at these centers, because we do know historically the Black and Brown communities do have a mistrust of the system and the government, and because of the historical things that have occurred when it comes to medical testing. All the way down from the Tuskegee experiment to Henrietta Lacks. I think that with the programs that we've been doing with the rapid testing has really helped build a good trust in the community and a good working relationship, and knowing that we are a partner in their health, and hopefully that will, as they get more information about the vaccine and see that it is the way that we can get back to work, get back to school, get back to communing with our families and our loved ones, that is the way that we can possibly get back to normalcy and fight the pandemic, that they will trust that we are a partner in their health, and they will allow us to continue to serve them in that way and remove some of the issues of vaccine hesitancy. So with that said, I'll hand it back to you, County Executive. And again, I thank you for inviting me today. I thank you for the partnership and the continued support from your office and the Erie County Department of Health, and the good work that the community centers led by the executive directors at each center are doing. Thank you.
Thank you, Dr. Jeffress, and thank you and the other physicians, Dr. Wagner and Dr. Snow, who've really taken this on too as a very important mission as a trusted source for the community. And now we're going to turn to the media for questions, and we'll start with the Erie Times News today. David, are you with us?
Yes, I am, Kathy. Thank you. I have a question for you and Melissa. We've seen lower numbers now for a few weeks. We see lower hospitalizations. Does it appear that it is less virus in the community, not so much that folks have mild cases that they're not getting tested or a lack of testing? Does it appear that, in fact, we are seeing truly a decline in COVID-19 in the county?
So I'm going to let Melissa address that. She has much more of the data at her hands. Thank you.
Thank you, County Executive, and David, thank you for the question. Per the conversations that I've been having as well with chief medical officers and hospital leadership in the region, it does appear that the testing numbers have resulted in lower cases across the region. So even though I've always said that I wish we had more surveillance testing available for those that are asymptomatic, we can make the assumption that those that are symptomatic are getting testing, and we are seeing less disease around the symptomatic. As far as what's happening asymptomatic, that's always going to be a little bit more difficult for us to measure and make positive statements around that. I hope answers your question, David.
Okay, and let me follow up with the county executive for a second. If we continue to see these numbers, I know it's often a state decision, but if we continue to see numbers this low for the next couple of weeks, can we anticipate a bit more broadening of restaurants and schools and other things like that, or are we really kind of at the mercy of statewide decisions on that?
Well, those decisions are made statewide, and that will be coming from the governor's office, from the Department of Education, PIAA. Those are the entities that really have the oversight on these restrictions that we've seen. But I do want to be cautious about this. We have good numbers now, but we all have to continue to do our part. We know the virus is still here. It's still in our community, and it's always, as I've said for a long time, it's always looking for its next host. So even if some of these restrictions would be eased up somewhat, we would still all need to be wearing our mask, trying to stay 6 foot away from each other, etc. Thank you. Erie News Now.
Thanks.
Yes, good afternoon, County Executive Isaac Petcash here with you. We've gotten a lot of calls into our newsroom of just a lot of people concerned that people from other states, examples of Ohio, New York, are coming into Pennsylvania, and particularly Erie, and essentially getting the vaccines as opposed to Erieites. I was wondering if you might be able to comment on that, any information you might have, and just if you've seen that on a county level.
So I haven't seen much of that. I think there are some cases, a few. I've heard some anecdotal. I don't have any data to back it up. I actually was talking to somebody who lives just over the state line, and they're physicians, and the medical group that they use is Erie County, and I think that elderly gentleman was going to come into Erie County to get his vaccine. I think that we've seen people certainly from our community who've gone to other states, particularly Florida. I've heard of a number of people who are snowbirds or down there for a month or two, and they are getting their vaccine in Florida. So I'm sure there's some of that going on. I think what we want to make sure is that the people getting the vaccine are the people in the highest risk groups. And of course, we'd like to see our own residents taken care of. But I don't want this to become something where we would deny someone whose physician and their medical care is done here, deny them just simply because they may live a few miles over a state line. As we know, these boundaries are just boundaries, and we all are a community that's much larger than even our boundaries. But I haven't heard of a lot of that going on. Go ahead.
If I could quickly get the executive follow-up, do you see that becoming problematic down the road? The state had obviously talked about that vaccines will be distributed essentially to the areas of the state that most need them, or whoever, based on population. Do you think that could be somewhat of a concern data-wise, that if there are certain people or a good amount of people who are coming from out of state receiving the vaccine in Erie County, that could kind of mess with the numbers as we move down the road here and more vaccines become available?
Well, I'll say one thing is we don't have enough vaccine, period. We don't have enough vaccine in Pennsylvania, in Erie County. We don't have enough vaccine in this country or in the states surrounding us. So there's not a very easy way for someone to come in here and get a vaccine, because it's difficult for everyone right now because we just don't have enough. So I don't see that being a problem at this point. And again, I haven't heard of any large numbers of people coming from other states into Erie County. I've only heard of a few anecdotal. I will tell you, though, that I have looked at the numbers from other counties, and there's counties, much smaller than us who, per capita, have received more vaccine, and I have brought that to the attention of the state. And I would hope that the distribution of vaccine would become more equitable based on population of your county. Thank you, Isaac. Talk Erie.
Yes, thank you, County Executive. Just back to that testing question again. Testing has dropped, and I'm wondering if there's a new strategy, considering that, as you mentioned, we still have a 10.8 PCR positivity rate, and our incidence rate is still higher than the state average per 100,000 residents. We basically have higher than average COVID here in Erie County still. according to the dashboards. Are you thinking about any additional strategies to get more people tested?
One thing, we continue to encourage people to get tested. And we believe that there's probably a lot of people with mild symptoms who think that they may have a cold or allergy or something else beside COVID. And I always tell people, err on the side that you have COVID. And if you go get your test and you're negative, great. But if you have it, a test and you're positive, of course, then you are quarantined and isolated from people and stop, hopefully, the spread. But I'm going to see if Director Lyon has anything further to say about this issue.
Yeah, thank you, County Executive and Joel, for the question. I like that you summarized why I'm still very adamant that testing is a very important part of our strategy to get through this pandemic. To ask about additional strategies, I, as the Public Health Director here, am always looking for additional resources that could help augment free and equitable access to testing. With the new federal administration and the number of executive orders that have been signed out of the new federal administration, there is a possibility that resources will become available. And if so, I assure you that the Erie County Department of Health will take a hard look if those resources will work for us to get additional testing into the community. Thanks.
Thank you.
May I add to that?
Yes, please, Dr. Jeffress.
Keep in mind that some of the testing is decreased because people who were positive before are not necessarily coming to get retested, whereas initially they were coming week after week after week to get retested to be admitted back to work. And then because the amount of resources, it was a stress on the system, we began to ask those people who had been previously positive, please don't come back for testing too early because other people need the testing. And so the number of tests have decreased in a sense as well because people who are positive are not getting repeat testing so often.
Thank you for that clarification too, Dr. Jeffress. And now we'll move on to Jet TV.
Hello, it's Star today. I would like to talk about the Pennsylvania distribution of the vaccine and how we are kind of in the lower aspect of getting things done. Just wanted to weigh in to see if the county executive, Kathy, if you've heard why this is so bad, and if you talk to state officials about what they plan on doing to get us up to speed in the state.
Well, all I can tell you is that I've, as the county executive, had made calls to representatives from the governor's office, as well as I've been speaking to some of our state reps to also make some phone calls. And my understanding is that our voices have been heard pretty loud down in Harrisburg, and they're going to try to look at, is the distribution equitable, and if not, how do they make it more equitable?
I guess from a command staff, down in Pennsylvania, what are they saying back to you, that they're just looking into it, or they have plans for us here, or how do they hope to move forward so we can get up to speed?
So I'm going to let Director Lyon address this too, because she's in on more of those direct calls with the state Department of Health and others.
Yeah, Star, I'm not sure that they've really returned our calls back with a specific strategy on how they're going to address equitable distribution of the vaccine. They've responded that they're using metrics to identify the highest need areas where vaccine is earmarked. But to be honest, and this is just not to keep repeating the same thing, there's just not a lot of vaccine coming to the Commonwealth to be distributed in large quantities. And I think we're feeling that, right? We just know that our population has a great demand and the supply is just not meeting that demand. If by chance I do hear of anything on the calls that I have with leadership at the state level, I will be sure to share that on press conferences into the future. Thank you.
Thank you, Star.
Thank you.
And we'll go back to David at Erie Times News.
Sure. Keeping on the theme of the vaccine, according to the information on the State Health Department website, it appears that Erie County has administered about 2/3 of the vaccine it's received, whether it's the hospitals or the chain pharmacies or who have you. It's a little bit higher than the statewide percentage from what I can gather. Is that saving about 1/3 of the vaccine, and it appears that some of the places are saving that for second doses for patients. Is that the right strategy, or should the county use all the vaccine on hand to give everybody at least a first dose and then count on that additional supplies to do second doses?
I'm going to let Melissa talk about that because some of this is a data issue also. Melissa?
Yeah, thanks, Kathy and David, for the question. I know, David, you and I had kind of talked through this a little bit the other day around whether facilities were holding back vaccine, and I had said that I cannot verify that that's actually happening, and I can't speak to the strategy as to why they would or wouldn't be doing that. That would actually be a direct question to the health systems that are administering it. I can talk from a health department perspective, and we are not holding back vaccine. We are using that to get first doses into individuals' arms. What happens when they get their first dose, they also then get scheduled for a second dose. And when we order vaccine, we can order vaccine for first dose and we can order vaccine for second dose. So the state actually knows that there is a quantity being ordered for first dose and a quantity being ordered for second dose. And it's my understanding that second dose vaccine then gets prioritized for approval and for shipment. So I'm really only speaking from the Erie County Department of Health's way of how we order vaccine, but I know all health systems use the same ordering platform, and so they as well have the opportunity to put in what they need for first dose and for second dose. So as I've explained it to you, there's really, from my understanding, no need to hold back doses for seconds, because the system is designed to take that into consideration. And according to the state press conference yesterday, they seem to have a system that's taking that all into consideration, and it seems to be working well, though I wouldn't want that headache. They seem to have it under control. So that's the best answer I can give you at this time. Thank you.
Sure. So the numbers they have on the state website that indicate this gap of about 1/3 of the doses, that could very well be, as far as you know, Melissa, that could be doses that are earmarked specifically for second doses for people. Could be. It doesn't specify on the site, but that it very well could be.
It could be, and it could also be the data lag that the county executive was referring to. So here's an example. If we don't have a system that communicates directly to the state immunization information system, we call it SIS. If you're not using a system that communicates to that directly, then you have to put that data in manually, and we can imagine that manual data entry is slowing down the accuracy of that. So if 1,000 doses are given tomorrow and we have to enter 1,000 doses manually, that's going to take us longer than a day, and then we'll run into a data lag. So it could also be related to the data lag.
Okay. Thanks, Melissa.
Thank you. Isaac with Erie News Now.
Yeah, this question might be for you, County Executive, but also might be for Director Lyon. We've seen local hospitals, UPMC Hammond, AHN St. Vincent, come out and talk about the fact that they're looking to target hard-hit zip codes. AHN St. Vincent last weekend had a vaccination event for people in the inner city that were at risk. UPMC has also come out and said, hey, we're looking to get hard-hit zip codes targeted first. I'm wondering if the county is planning on doing the same. I know Director Lyon and I had a conversation last week just talking about, where the locations of potential mass vaccination sites would be. Would they be in the inner city? I'm just wondering if the county is going to plan to target hard-hit zip codes by this pandemic in addition to the local hospitals we have here.
Director Lyon?
Yeah, thank you for that question, because I think one of the things that maybe as a public health director for Erie County that I've not done well is demonstrated or exemplified the work that's being done by the health department planning team for vaccination. So while the Erie County Department of Health public health nurses are not necessarily going to be putting vaccines into the arms of individuals, what we are doing is we are contracting and working very closely with the health systems to identify those high-risk zip codes or high-risk populations, which is really our world of expertise. That's what we do as public health departments, is we end up being a safety net many times. We work with populations that tend to be vulnerable or have access barriers to access to care. So I say all this to say that there's really been a strong partnership, and we've been identifying this right along. So I do sort of apologize here that maybe that doesn't seem as the health department has been doing that, because we have. An example will be going to housing, senior housing, identifying places that would be close to bus stops. And working with a larger clinic space that could be expanded upon. So you'll be hearing more about that in the hopefully very near future. When I say that, it would be around vaccine availability. So there seems to be, I'm not going to divulge a lot of details until I'm absolutely sure that we have all the resources to be doing the work that we've put all the planning efforts into. So thank you for allowing me to answer that thoroughly as I have. Thanks.
Thanks, Isaac. Talk Erie, Joel.
Yes, thank you, County Executive. This question is for Dr. Jeffers. Dr. Jeffers, can you explain the rapid testing that's been going on at the community centers? LECOM had demonstrated a rapid testing in their new mobile unit, and it seems like there's still a lot of people that are waiting the 2, 4, 5 days to get the regular PCR test. How does that compare to what has been offered at the community centers, and do you see more rapid testing getting out there in the community?
Yes, thank you for that question. The rapid testing that is occurring at the centers is a PCR nasal swab, and it varies based, the results come out in anywhere from 24 to 72 hours. If the testing falls on a holiday, then sometimes it could be longer. And the people are instructed to quarantine until they get their results. And honestly, when I talk to people on the phone when we're delivering results, they really seem to be complying with that. You may call someone in 24 hours, they've been quarantining. You may call someone in 5 days if it falls on a holiday or over a holiday, and they've been quarantining since they got tested at the community center. The testing is being run on Tuesdays at Booker T. Washington Center, which is on 18th and Holland, Martin Luther King Center from 9:30 to 3:30 on Thursdays, and Wednesdays is, and they're on 3rd and Chestnut, I believe, and Quality of Life Learning Center in JFK, John F. Kennedy Center, is out on the east side by GE, just off of McClellan, and that's running from 11 to 2, I do believe, or 11 to 1. So these testing sites are available. They are only accepting up to 100 per site per week. So it really is on a first come, first served basis. The testing that is being done at the major healthcare systems, LECOM, UPMC, AHN, and the primary care doctors are referring their patients to the testing sites mainly for symptomatic patients. And whereas that is a great distinction between the community center testing, is that they were really accepting anyone, both symptomatic and asymptomatic. And I really think that there's no difference in the testing per se. The testing is just coming back at the same rate if you get tested at a healthcare system or if you get tested at the community center. And so there's great quality of care at all the places. It is really difficult, just being honest, if you put yourself in the shoes of the major healthcare systems, because they have a larger burden. They are taking care of not just the emergency rooms, they're taking care of their inpatient population. And so naturally, it's a little bit challenging to get testing through the major healthcare systems unless you're symptomatic and you're sent in, through your primary care doctor. And we're also encouraging people to make virtual appointments to follow up with their family doctors. And it really is, especially in this underserved area, it's really a unique chance for us to get people linked back into the primary care systems. So if you can get like an appointment with your family doctor or an appointment with your virtual primary care, and if you don't have a doctor, this is our chance to get you hooked back into the system. So we've been telling people, if you don't have a family doctor or primary care doctor or an internal medicine physician, call Community Health Net, call Wayne Primary Care, call Primary Health Network, call UPMC, St. Vincent, LECOM, and get in. And then LECOM is now really focusing on their mobile vaccination unit and mobile testing unit. And I do believe AHN as well. So that's really good. That'll get into the hard to get areas like the senior housing units, and also some rural areas. So hopefully that will expand and broaden the testing that can be done.
Thank you.
Jet TV Star.
Yes, back again to the vaccine distribution here in Pennsylvania. I understand that the rollout could be slow in the state of Pennsylvania. However, other states across the country are getting the vaccines in a more quicker manner. Just wanted to see if you can weigh in on that in regards to why the state of Pennsylvania could be slow compared to, say, like you were saying earlier, Florida, where many people are going to get the vaccine where it's available. Where in the governor's standpoint and these health officials are weighing in on this?
So I'm going to ask Director Lyon to address this, but I will say that I think every state in the union has been struggling a bit with this. Some have done better than others, and that those states that have done better, actually the federal government's looking at that and seeing if there's best practices that could be transferred to other states. You have to remember, this pandemic is something none of us have ever experienced. It's been over 100 years since we've had anything like this, and so we're all learning from each other and trying to bring forward best practices. But I think Pennsylvania's tried to do the best they can with the vaccine that's come in. But I'm going to see if Director Lyon has anything further to add to that.
Yeah, as far as comparing Pennsylvania to other states in the nation, I think it's hard to say that everything is equitable from state to state, right? So you would have to say that every state had the same health system design and every state had the same infrastructure, and that's just not the case, right? We know that each state is governed differently and they have the ability to make decisions that work for them. So I think it might be a little bit unfair to say that Pennsylvania is doing poorly for some reason outside of their control, right? With that all being said, I think the county executive has answered this question very well. I would only add that this should highlight the importance of a real, robust public health infrastructure for the entire nation, so that we have the ability to implement the best practices that will be discovered throughout the pandemic, and who did certain pieces of this work very well, and how do we replicate that across our nation. So I look forward to that as a public health practitioner. So with that being said, I'll stop there and hand it back to questioning. Thank you.
Thank you. We'll go back to Erie Times News. David, do you have a final question?
Yes, I do. For Melissa. Melissa, you had mentioned a little bit earlier about how the reduced numbers of new cases have allowed the health department to do more contact tracing and disease investigation. Is it back to what it was like before Thanksgiving? Can you give me a little bit of details on how thorough it is right now and how it compares to what you guys were able to do in the summer and early fall?
Yeah, so the reports that I'm getting in our daily operations meetings is that disease investigation is now able to get through the day's numbers. So we were very thankful to see today's numbers being low because we figured we could make contacts with all of them fairly quickly. So we had to bring on new staff for all of that. So keep that in mind, training that staff and having them be efficient and effective. I think we're really close to where we had been, I'm going to say midsummer, and I'm really just sort of taking a guess here. As long as these numbers stay where they are, you're going to see the disease investigation and contact tracing remaining very robust and consistent. I think the problem had been when we had numbers that were way over 100 and as many times reached 200, our consistency was just not there because we knew that we couldn't get to all of those cases in a day. So we would just try to start new each day with the highest risk cases or where we thought we'd have the most impact. But we're now able to reach all of them, so we don't have to prioritize right now. So it feels really good from a public health perspective. Thanks.
Sure. So you're able to reach all of the people that have tested positive, and you're able to reach all of the people they are in contact with as well?
If we're able to collect that information from them, that answer would be yes. We're moving our contact tracing portion, which is really people check in on a daily basis on where they are symptomatically. And I was just thinking about, we used to talk in great detail on what the difference between disease investigation was and what contact tracing is. So contact tracing is going to be more automated, and being more automated, that's definitely going to give us a greater capacity and being very effective. So thank you.
Thanks.
Isaac with Erie News Now. Do you have a final question?
Yes, County Executive, this is going to be one of the first major holiday weekends for going out, eating, whatever you might be doing. Of course, we've had a lot of restrictions when it comes to Thanksgiving, Christmas, St. Patrick's Day, New Year's Eve, things of that nature. So just if you happen to have a message for people that might be looking to just go out for Valentine's Day weekend, looking to enjoy themselves, knowing the pandemic's still going on, just the concern you might have for maybe an overflow of going out to restaurants and bars and things of that nature.
Well, thank you for that. That's a great question and a segue into Happy Valentine's Day to everyone. So if you want to go out to a restaurant and you're going to call to make a reservation, find out what their mitigation efforts are. What do they do to try to make sure you're safe when you are in their restaurant? Make sure you're comfortable with that. When you actually arrive at the restaurant, make sure you're comfortable with what you see and what you experience. And if you're not comfortable with that, if you feel like it's not set up the way it should be, then exit and go home. And so that's the first thing I would do. I would secondly think about, is there a romantic dinner you can cook at home? That's the best thing to do. That's what I'm going to do for my husband. But, whatever you can do to try to keep yourself safe. And you have to be comfortable. I've said this from the beginning. You have to be comfortable yourself, and a lot of that may depend on your own situation, how vulnerable your health is, etc. But I think that the main thing is to have that kind of conversation with the restaurant, make sure they're following all of the mitigation efforts that have been put forward, and then when you get there, again, survey it and make sure that they are. And if you are going to stay home, you might want to even order out so you can support that local business even though you maybe don't feel comfortable going there. So support your local businesses. Tip well is what I keep saying too, because again, they're struggling and we're trying to help them out as much as we can. Talk Erie, Joel, do you have? Oh, I'm sorry. Go ahead, Isaac. Did you have something you want to follow up on?
Oh, no, I was just saying thank you. You're good.
Okay. Talk Erie. Do you have a final question, Joel?
Yes, for you, County Executive. Many of my listeners have already gotten their second dose. They might be in upper ages or are healthcare workers. What's the common sense message to them? I mean, after 12 months, 10 months of not seeing their grandchildren, isn't it okay to give them a hug, maybe to kind of start open things up if they're fully vaccinated?
So remember that the vaccine is 95% effective. That's great. There's 5% of the people who actually do not have that immune response from the vaccine. So that's why even after you get the vaccine, everyone is told they need to continue to wear their mask, keep their social distance, etc. I guess I'd say, they should really have a conversation with their physician about this because most of the young people, their grandchildren, et cetera, have not been vaccinated. Many of these children are in school, maybe playing sports. They're actually some of the people, who have the mild symptoms but are actually spreading it around. We've seen that. We've talked about the sports before. So again, you've got to be cautious. This virus is looking for its next host. And we have read reports recently of people who've had both shots and they are coming down with COVID-19. So there is that small percentage of people who don't have enough antibody buildup from this vaccine. That's why we need to get more and more people vaccinated and get people to the point where we have that herd immunity and hopefully see our numbers truly drop and stay dropped. And we'll finish up with Jet TV. Star, do you have a final question?
Yes, just wanted to ask if there was any fear in residents here in Erie County that could potentially go to our neighboring states, Ohio and New York, to get the vaccine and then come back, or vice versa. What are your thoughts on that? Does that raise concern to you?
We don't have control on what people do individually, and we may have similar circumstances to the one I talked about from a resident in Ripley who was coming over here where their doctor's at. We may have that same thing happening. Somebody might have a doctor in Crawford County, or they might have a doctor in Ashtabula or some other place right next to us. So, or maybe they go to the Cleveland Clinic. Maybe they have some serious illness and they're going there for treatment and they get a vaccine there. So it does happen. It will happen. What we want is we want everyone to get vaccinated. And so doctors and health facilities and others who are doing the vaccination are making those priorities, hopefully, with the best decision-making tools they have, and eventually we can get everybody vaccinated. Thank you. So I just want to finish up by reminding everybody that our website, eriecountypa.gov, does have all of the places you can go to get testing. Lots and lots of great information on there. So I know Dr. Jeffers talked about the hours and the locations of those testing sites, and you can find all that at eriecountypa.gov under our COVID information page. And a few of our star businesses, the Sanctuary Tattoo on Liberty Street, only allowing 8 people in the building, including artists, and operating by appointment only. The door is locked. You can only get in if you have that appointment. You must properly wear your face mask, and they're trying to keep both their tattoo artists and their customers as safe as possible. They even have a COVID-19 waiver that customers fill out to confirm no one receiving that tattoo has any symptoms of the COVID that would put the artists and others at risk. And Davis's Country Kitchen in Northeast is also doing an excellent job. They did the state self-certification process, increasing their capacity to 50%. Masks are required for entry. Their staff wears masks. They have blocked off tables for social distancing. Floor stickers that indicate a 6-foot distance. Capacity 28 people is visibly posted on the door. And doing takeout meals if you don't want to dine in. You might want to check that state website for those restaurants that have certified as you're looking to possibly go out and have that Valentine date with your loved one, and support those restaurants that are actually trying to do the right thing and keep you safe. So as always, thank you to those businesses. Thank you to all of you. Let's hope that next week when I come back we have, again, low numbers to report. Please continue to do everything you can. Wear your mask properly, wash your hands frequently, stay as close as home, out of crowds, 6 feet away from anyone you don't live with, and please stay safe and stay calm. Thank you.
You've been watching today's update on COVID-19 from Erie County Executive Kathy Dahlkemper. Just a few of the headlines coming out of this week. Kathy really came out of the gate with the headline saying it was a good news, bad news situation. The good news in Erie County is that the number of new cases, the number of hospitalizations, and the number of people on ventilators, all of those categories down in Erie County. The bad news is she had 5 more deaths to report. The total in Erie County is now 413 since the pandemic began. Regarding the slow vaccine rollout in Pennsylvania and in Erie County that has frustrated so many people, even those in the so-called Phase 1A who have for weeks been trying to get appointments to get vaccine. Dahlkemper basically said she urged everyone to exercise patience, and that was about the extent of it at this point. So at that point, let's talk about the numbers. Again, We're talking about one of the lowest daily counts in months, 23 new cases. Kathy Dahlkemper saying that that's the lowest number she's seen since October. The total in Erie County now 16,220. You see the numbers there. Crawford County's new number 32. Warren County up 14. Chautauqua County 40. Ashtabula County, Ohio up by 98. The Commonwealth is reporting 3,378 new cases. The total now eclipsing 880,000. Another 125 deaths reported. That total is now 22,745. As always, we've been saying it for almost a year now. The best advice is to stay home, stay calm, wash your hands, social distance, at least 6 feet away, and wear a mask. And Kathy Dahlkemper and Melissa Lyon and Dr. Andrea Jeffress today all stressing the importance of continuing to do the basics. We'll have a complete wrap-up tonight on Jet 24 beginning at 5 o'clock. I want to thank you for joining us. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled program.